All right, good evening, everyone. My name is Joe Durant. I'm one of the senior instructors for the Center for Pain and Stress Research. And tonight we are going to be doing a tutorial on the Dolphin Neurostim. So if you have one, please do pull it out so you have it handy as we go over it. And if you will look, hit the mute button on your microphone so we don't hear any background noise from anybody's microphones. We don't hear cats and dogs and children and people upstairs and whatever else. So we're going to do about an hour of instruction tonight, and then we're going to set aside about 30 minutes for question and answer. Before I get started, I do want to mention that you guys are going to get an invitation tomorrow in the mail to join our Facebook forum. It's a really good place to ask questions if you have any that come up. Also, you will get a link so that you can watch this tutorial over again. So if you miss anything tonight, you can certainly watch it over again in the future at no cost to you. Anyway. So if you have a Dolphin Neurostim out, please grab it, and we will start going over it now. So looking at the Dolphin Neurostim from tip to back, starting at the tip, we have an alloy, a biocompatible alloy tip here, and it is, hang on just a minute, let me turn this off so you guys don't hear my phone in the background. Let's see here. All right, so we have a biocompatible alloy tip here. You will notice if you push on it, it is spring-loaded. So when you go about cleaning these, I do not recommend using like liquids on it, like plain alcohol, unless you're going to put it on a wipe of some kind. Because if you get liquid down in here, there's a conductive medium in here that helps the tip conduct with the spring, the electrical conductivity. So you don't want to rinse that away. It's going to affect your performance. So just clean the tip carefully with alcohol wipes and you should be fine. Moving up from here, you will notice there's a black button right here with the unit off. You notice if you push it, it does absolutely nothing. But once the unit is on, that will be the button you push to initiate treatments. So that brings me to this little roller switch right here. This is your on and off switch. But this switch also accomplishes several other things. First of all, when you turn it on, that is the on button for the unit. And when you roll the unit over, you'll notice there's a green light that comes on. So if you see that green light, that lets you know that you have a good battery. So that's always your battery check. There's not a battery check push button on here anywhere. Your battery check is when you turn the unit on and see that green light. So if you don't see the green light, it's time to change the battery. So I think I have a unit here somewhere that needs a battery change. Let me see if I can lay hands on it. Let's see here, and I'll show you what that looks like. So this unit, you can hear that it's on. You can hear a tone, but when I flip it over, there is no green light here. So that's my cue that I need to change the battery. So these use a standard 9-volt battery. To change the battery, you're going to need either a coin or a flathead screwdriver or a pocket knife or something like that. I do want to point out that on this unit, there are 2 screws at either end of the unit. Those screws hold this entire unit together. And we have had a lot of problems in the past with people taking these screws out trying to change the batteries. So I'm just going to tell you, like, if you take the screws out of this, 2 things are going to happen. The first thing is it's going to void your warranty. And the second thing is that parts of this unit are going to go flying all over the place. You're going to have to send it to us to have it put back together again. So please, if you go to change a battery, don't take these screws out, okay? To change a battery, you will notice there is a conveniently located battery plate right here. So if you just pop this cover off, it's a tight fit, but when you pop it off, you will see there is a standard 9-volt battery in here. These happen to be Panasonic batteries, which is what they come stock with. There are 3 batteries we recommend for this unit. So I'm going to go over those with you real quick. We recommend Panasonic batteries, we recommend Duracell batteries, and we recommend Energizer batteries. At this point, we do not recommend any other batteries for this unit. I know that seems a bit restrictive, but there are 2 very good reasons for that. One is that not all 9-volt batteries are the same size. I know that seems strange, but AA batteries and C batteries and D batteries and AAA batteries, those are all the same size. The 9-volt batteries, some are a little bit longer, some are a little bit shorter. So this is a very tight compartment. And you'll notice there are no wires in here. So we eliminate the wires so that there's nothing to break off. But the trade-off is that it is an exactly fitted compartment. So if you have a battery that's too small, it's going to rattle around inside this unit, and you're going to get intermittent contacts, and you're not going to get a good treatment. If the battery is too long, you're actually going to push on this plastic post in here. You can actually break that. and then your unit's not going to perform the way you need it to. So just use either Panasonic batteries, Energizer batteries, or Duracell batteries. And for goodness sakes, don't use any cheap dollar store batteries in these, because dollar store batteries have a really bad habit of dumping all their voltage at once, and all that extra voltage can actually damage the electrical equipment inside the unit. So stick to standard 9-volt batteries. As a therapist, I use these units probably, well, let's see, I start seeing patients at 8 o'clock in the morning and I finish at 6 o'clock at night. I probably use them for at least 20 minutes during each of my treatment sessions. And one of these batteries will last me about a month. So you're going to get a long time out of these batteries. If you're doing a lot of vagus neurostimulation or something like that on yourself, obviously they're not going to last quite as long, but you should get a lot of life out of a single 9-volt battery. Okay. So to replace the battery, you're going to look, there's a little chart in here that shows you how the batteries go in. You're going to slide it in. It is a tight fit. And especially once you put this plate on here, you're going to notice it's really hard to push this back on and it's going to snap. You're almost going to think it's going to break. I promise you it won't. It's just made to be really tight. So once you have that in, if you use this roller switch and turn the unit on, you're going to look for that green light. And as soon as you see that green light, as soon as you see the green light, you're good to go. Now, the other thing this roller switch does is control the intensity of the unit. So when you're doing a treatment, if you find that it's uncomfortable, you can actually turn this down some. So the more you roll it, the more intense the treatment is. Right. And then once you roll it all the way back, the unit's off, it's making no noise, the light's off again. So moving up from there, there is a little tiny button right here, a little black button with the unit off. You'll notice it doesn't do anything. But if I turn the unit on, again, nice green light. If I turn the unit on and push this button, you'll notice the unit is not making any noise. But if you flip it over, you'll notice that this light is blinking. So now the unit is in a timed treatment mode. So this will run for somewhere between 12 and 14 minutes. And after that time period, it will revert back to what we call the search mode, which is a steady tone and a green light. So that allows you to do things like vagus neurostimulation, but not hold the button down the entire time. Or if you're doing something like a scar treatment, you might also want to use that button too, because it's a lot of pushing the button down for long periods of time. So it just saves your hands. This will also keep you from doing vagus nerve stimulation on yourself and falling asleep with it and then waking up the next morning after having had 6 or 7 hours of vagus nerve stimulation, which will make you a little bit tired the next day. Trust me, I've done it. All right. So on the back side of the unit, up here we have a lovely Dolphin Neurostim insignia here with a yin and yang with dolphins. Kind of cool, huh? All right. On the back, there's a little metal plate right here. When you are doing treatments, you must be touching this metal plate. So electrons have to come out of the tip of this unit and they have to circulate back in here. They do that through your thumb. So when you hold this, you're going to hold it like you're holding a ballpoint pen. It is very not particularly comfortable or easy to accomplish treatments if you're holding it with your fingers on this plate. I have seen it done, but it doesn't work particularly well. So I do recommend that you hold it like you would hold a ballpoint pen. This way your thumb is resting comfortably on the metal plate. You can use the heel of your hand as a fulcrum so you can find acupuncture points with it, because this unit does find acupuncture points. Up from there, there's a slider switch that says wet, dry, and normal. So that slider switch it doesn't affect the intensity of the treatment. It affects the sensitivity of the ohm meter in this unit. So this unit actually finds acupuncture points, myofascial trigger points, and motor points. It does that by measuring how conductive your skin is to electricity. So if you take an electrician's ohm meter and you run it around your body, you're going to find some areas of the body that conduct electricity well and some areas that don't. The areas that conduct electricity well are all Chinese acupuncture points or myofascial trigger points or motor points in muscles. All those are functionally the same thing. So if you found one, you've probably found the others. This is actually a very accurate point finder, but you will notice that people have very different types of skin. If you live like I live down in the States in Georgia, and it is summertime here and it is hot, and most of my patients who come in are sweaty. So they have a lot of salt water on their skin from sweat, which means that all of their skin is going to be very conductive to electricity. So if I use this on a really sensitive setting, I'm going to find acupuncture points and treatment points where there aren't any, just because their skin is conductive all over. So I need to slide this over to the wet setting. But if I were, say, up in, I don't know, Michigan or Wisconsin or something in February, when it's really cold and it's really dry, people use a lot of lotion on their skin, and their skin is really dry, and the heat's on in their homes. So you want to slide it over to the dry setting over here. Now, if you live in a moderate climate, you just probably want to keep it on the normal setting. What I will say is occasionally you run into people who have super duper dry skin. Those tend to be people who are spending a lot of time in nursing homes, and they don't tend to drink enough water, and their skin is typically, and there's a lot of air conditioning running in there, so they tend to have very dry skin. So in that case, you may actually want to take a paper towel, wet it, wipe it over their skin, and dry it off, and that should hydrate their skin enough for you to be able to find treatment points. All right. Now, there is one more slider switch on here, and you will see, let's see if I can get this to focus for you. You will see it says polarity right here. And this polarity has a minus symbol, a plus symbol, and a plus minus symbol. So the minus symbol is for sedation in acupuncture, which is to bring things down. That's 99.9% of what you guys are going to be doing. So that's for things like muscles that are too tight, pain, headaches, nausea, vomiting, constipation, strokes, heart attacks, any kind of autoimmune disorders, most types of sprains and strains. So for the most part, if you just keep this on the negative setting, that's going to be most of what you want to do. However, there is a book that comes with your equipment. Let me see if I can lay hands on one of them. I should have it right here. Well, here's one of the books right here. And you will notice that in the books, so here's a protocol for, let's see here. Oh, gosh. Let's find a good one. Here's a pancreatitis protocol. So you will notice next to each of these points, there is either a minus or a plus on the little graph over here. So it'll actually tell you what polarity you need to use. So whenever you're doing treatments and you're looking at our manuals, just look and it'll tell you, it'll have a plus or a minus next to each of the points. So there's a guide for you there. But the plus symbol on here is for tonification. So in acupuncture, that's bringing things up. So that would be things like Bell's palsy, where somebody's face is drooping, or you're doing something like an acupuncture facelift where you're trying to get muscles to be a little more toned. Those are situations where you might use that. Sometimes you might use that in, say, like urinary incontinence because you're trying to strengthen things. But for the most part, you're going to be using a negative polarity. And then there's one more position of the slider switch, which is that positive negative symbol. So that gives you a biphasic current on here. That's used mostly for tissue damage, like immediate tissue damage. And you're going to find that useful when you start treating scars. So that is all of the features of the Dolphin Neurostim. So now we need to go over how to use this to locate treatment points. So there are a lot of people, before I start into that, a lot of people get caught up in looking at the light on this unit. And they'll look at it when they're treating points, and they'll look at it when they're finding points, and they'll look at it when they connect different things and try and figure out what's going on. So if you look at this light too often, it's going to drive you crazy, okay? So my best advice to you is this. When you turn this unit on, look at the light. You got a green light, you're good to go. The only other time you really want to look at the light on here, unless you want to be confused, is when you're actually finding treatment points. So this unit is designed so that it measures how conductive your skin is. So this has an ohmmeter in it, but it's not connected to a dial. It's connected to a tone, and it's connected to a light. So when you find your treatment points, the light is going to go off. Once you see that light go off and you push this button to conduct a treatment, stop looking at the light. Sometimes it'll blink, sometimes it won't blink. Sometimes it'll blink 1 or 2 times, and then it'll stop blinking. Just don't pay any attention to it, because all you're going to do is confuse yourself. You're going to end up asking questions that have been answered, and you're going to call the company, and they're going to tell you the same thing they've told everybody else, which is look at the light when you turn it on and look at the light when you're finding points. So how do you find a point? Well, let's find a few points to look at. So I'm going to look in the vagus nerve recovery manual that comes with the unit if you have a vagus nerve kit. If you don't have the vagus nerve kit, that's okay. This is just a demonstration of how to find a few treatment points here. So we are going to look for the following points. We're going to look for large intestine 4 right here, and we're going to look for large intestine 11 right here. So you'll notice that in your books, each of these points um, has a couple of initials beside it. Those are indicative of the acupuncture meridians. So there are energy lines in acupuncture known as meridians. Each of the meridians is named after an organ system. So it's going to be things like your lung, pericardium, heart, liver, spleen, kidneys, um, stomach, large intestine, small intestine. You can have all these organs, okay? Now, for practical purposes, this is what you need to know. The female organs, those are the yin organs, are on the soft parts of your body. So they're at the front of your body and on the insides of your legs and insides of your arms. They're on the soft parts of your body. The male, and those are things like your heart, your lungs, your liver, your kidneys. They are the things that are like a mother. They're always working and they're vital for life. And if you damage them, you're probably going to die. The male organs, the yang organs, tend to be on the hard parts of the body. So that's like your back, the outsides of your arms, the outsides of your legs. And those are indicative more of things like your stomach, your small intestines, your large intestines, your bladder. They are things that, according to one of the acupuncture textbooks I read, they are like a man. They are hollow, superficial. They tend to fill up and empty, and you can live without them. So there's acupuncture's opinion of men for you. The female organs actually are quite a bit more important. They are the calming side of things. So when you look at a yin and yang symbol, so if we look at the little dolphin symbol here, the blue side is the yin side. That's the female side. So when you're trying to calm the system down, you do use female yin points. If you are trying to do things like, let's say, fix a frozen shoulder or do something functional like that, then you're going to end up using more male points, more yang points, which is on the white side of this. Okay. But generally, for most things, if you're trying to calm things down, you're going to use female points, and that's the parasympathetic nervous system. So the white side of this is the sympathetic nervous system. That's your fight or flight response. And the darker side of this is the parasympathetic nervous system, which is what they call the rest and digest side of things. Just for reference, you have to spend 70% of your day on the parasympathetic side, on the blue side. If you spend any less than that, you're in trouble. Your body needs that much recovery time every single day. So if your system is in overdrive from, it could be any number of things like traumas that are still plaguing you of one kind or another, surgical scars, some kind of toxic exposure to heavy metals or mold or whatever it is, some kind of intense pain, anything that's going to keep your system upregulated affects your ability to recover. So sometimes we actually have to manipulate the nervous system using microcurrent to allow the body to heal from things. All right. So how do we find points? Well, the first thing we're going to do is we're going to turn the unit on. We're going to look at the light. We got a nice green light there. Then I'm going to make sure I'm touching this metal plate. Now, if I'm trying to find points on someone else, not me, but on someone else. So we're going to pretend like this hand is somebody else's hand. And I'm looking for a point called large intestine 4. So large intestine 4 is this point right here. It's called Hoku. It's also known as the great eliminator in acupuncture. You've probably heard of it before. People say, hey, if you have a headache, rub between your index finger and your thumb. Most people actually miss the point. They go in the web right here. It's not in the web. It's actually up in the muscle right here. So if I take my hand and squeeze it like this, you'll see a little mountain of flesh sort of comes up right there. Well, at the top of that mountain, that's my acupuncture point. So I'm going to mark that so you guys can see it. So that's about what it looks like. And if I squeeze on that, if I pinch from side to side, it is quite tender. So that is the true location of Hoku, large intestine 4, the great eliminator. It's a great point for things like tension headaches. It's a terrible point for migraine headaches. It can actually cause rebound headaches. So avoid that one if you happen to have migraines. Great for facial pains and jaw pain and tension headaches. It can affect migraine headaches, but in about 50% of the cases, it'll cause a rebound headache that's even worse than the original migraine. So we do not recommend that one. Okay, so now I have my acupuncture point marked. I've checked it. It is indeed tender. And there's a little hollow right there. If I were going to give you guys a piece of advice on finding acupuncture points, the best general piece of advice I can give you is that most acupuncture points tend to be in dips and hollows. So you might want to write down dips and hollows. If you go run your fingers over your body and feel for dips and hollows, and then look at an acupuncture doll like this, you will probably locate an acupuncture point in that general area. Okay, so got my Dolphin Neurostim, got my thumb on the plate. I'm going to turn it on. I'm going to set it on the normal setting since it is relatively dry in here because the air conditioner is on. And we're going to pretend like I have I don't know, a facial headache of some kind. So I'm going to put this on the negative setting. So now I want to look for a treatment point. Now, when I'm looking for points, I'm not going to push this button, okay? If I push this button, you see this light blinking and you hear this beeping. When you hear this beeping, that means I'm actually doing a treatment. So I cannot find a treatment point while I'm treating, okay? So when you turn this device on, when you simply roll the switch on, that puts it in what we call search mode. So before you ever push this button, you need to find your point first. So if this were someone else's hand, I would take my hand and I would drop it down so that I can use the dolphin, I can use the heel of my hand as a fulcrum, and now I can pull this around. And you can hear when I get over the point a really high pitch. And I'm going to do what I told you not to do, which is turn the unit around. But I'm going to show you that when I'm on the point, see how the light goes off? If I move off the point, light's green. And once you get pretty close to the point and over the point, the light goes out again, okay? So the two clues you're going to get that you're over an acupuncture point is the light's going to go off and you're going to hear a really high pitch. The higher the pitch, the more conductive the area is. And if we're going to get into the absolute semantics of the whole thing, I rarely ever look at the light when I'm looking for points. It is extremely satisfying to see the light go off on this unit. However, a really high pitch is enough to tell you that you're over the point. So when you hear a really high pitch, you're in a good location. All right. So once we find the point, so I've got my hand like this. I've got my thumb on the metal plate. I've located my acupuncture point. Now I'm going to depress this button. And I'm going to hear the unit start to beep. Now, if I find that it's too intense, I can actually use my finger, my index finger, to roll this roller switch back a little bit to make it less intense. I'm not using a lot of pressure. This is just the weight of the unit. And I'm going to count about 30 beeps. So for most treatments, it's not 30 seconds. Count out about 30 beeps. There are certainly times when you may go a lot longer than that. And there are certainly times where you may go less than that. But 30 beeps is a good starting point for you. Okay, so once I've done that for 30 beeps, I'm going to move on to the next point. So the next point I'm going to look for is this point at the end of the elbow crease, large intestine 11. Large intestine 11 is a really good homeostatic point in acupuncture. It's good for things like bringing fevers down. And it's for general homeostasis. So how do I go about finding large intestine 11? Well, if I go to the crease of my elbow, so if I bring my arm up and flex my arm just a little bit, you'll notice there is a crease right here. And if I go to the very end of that crease, this is large intestine 11 right here. You can see a little red X right there. So I'm going to take this Dolphin Neurostim, turn it on, check to make sure I have a green light. It tells me the battery is good. And I'm going to roll this around so you can see it. I'm going to drop my hand down so I have skin-to-skin contact, because if you're doing this on someone else, you have to have skin-to-skin contact with them. I'm going to pull this across the skin until I hear a high pitch and the light goes out. So now I've found my acupuncture point. I'm going to push the button down and hold it for about 30 beeps. You're going to feel anything from, it's not going to shock you. It's going to feel anything from just feel like somebody's pushing on there a little bit to like somebody's jabbing it with something sharp. Okay, so it can feel pretty sharp sometimes. So that's why you can roll this up or down. And what you'll find is some points you're going to treat, your patient or you is barely going to notice it. And then you're, without changing the intensity of this, you'll move to another point. And that point is much more sensitive. So that's a point you're probably going to want to come back to in the future, because that's a point that's probably involved in your problem. Because the worse your problems are, the more those the more those points become conductive to electricity. And the higher the pitch is going to be on the unit, the more you're going to feel it. So even if you don't believe in acupuncture points, like if you just absolutely don't believe in acupuncture whatsoever, and you're interested in this modality just for the purpose of microcurrent, what microcurrent does to the body, because microcurrent does a lot of really cool things, you have to find acupuncture points to get the stuff into the body. This is microamps, which means it's millions of amps. So it's a tiny amount of current. It's not much at all. So the only way you're going to get this through the skin effectively is to go to an acupuncture point, because those are the most effective points in the body. So if you don't find those points, it's much more difficult to be able to do treatments on someone. It's going to cut into your efficacy quite a bit. So there are a couple of mistakes you can make on this. And one of the mistakes is that you can push too hard. So if you take this device and you push too hard on the skin, what's going to happen is you're going to compress the skin. So I'm going to give you a demonstration. There isn't really an acupuncture point right here, but I'm going to turn the Dolphin Neurostim on, and I'm going to let you watch the light. And I'm going to set it down, and nothing happens. But if I push really hard, you see that the light goes out. And I can move to another point and push really hard, and the light will go out. So if I keep doing that, it's going to look like I'm finding points, but I'm not really finding points. What I'm doing is I'm pushing so hard on the skin that it actually becomes conductive to electricity. So the biggest mistake you can make is pushing too hard on the skin, which is why I encourage you to hold the device like this and rest your hand like this on your patient, so that two things happen. Number one, you have skin-to-skin contact, because electricity has to go into the tip, come up through the palm of my hand, and go back through this metal plate. If you are not touching this metal plate when you are doing treatments, you are doing nothing but acupressure, okay? You've either got to have a pad on this plate conducted to a wire that goes to your patient, or you must have contact with this metal plate. Okay, so don't push too hard when you're looking for points. The other piece of advice I can give you is go slowly. Okay, if you move really fast with this, you're going to miss the points. But if you move slowly and use very deliberate circles, you're going to find your points with no problems. Now, sometimes people have a problem maintaining skin-to-skin contact. So there is something you can do about that. I don't know what you guys have in your kits, what you bought or haven't bought, but there is a double wrist strap like this that you can get from the company if you don't have one. The way this works is I put this on my wrist or on my ankle or whatever, and I put this on my patient. So this goes on their wrist or their ankle, or I don't care. They can hold it up to their face, but this metal plate needs to touch the patient. Now, whoever this is on is electrically connected to me, okay? So if that's the case, I don't have to have skin-to-skin contact with them. I still have to touch this metal plate, but I don't have to have skin-to-skin contact. Hey guys, hey guys, check your buttons and make sure that your computers are muted. I can hear some talking in the background. Thank you. All right. So this is available if you want it. It's a useful thing to have if you're going to work in people's scalps. If you're going to work on scars in somebody's scalp, or you're trying to treat acupuncture points in someone's scalp, the hair is going to get in your way of being able to find acupuncture points. So these are good to have. These are about $25. So I can't remember what they call it. I would just call it the double wrist strap. If you call the company, they'll know what you're talking about. Okay. So that's how you go about finding acupuncture points. We have protocols for all kinds of things. Everything from, gosh, let's see what I've got here. We have everything from concussion protocols to scar protocols to all kinds of things like that. And some of them are in some of our workshops. I just got done teaching a scar workshop down in Durant, Florida. So there are some pre-recorded workshops that we have that you can watch. We do offer some live online workshops that you can attend, and we also offer some in-person workshops as well. Coming up in the near future, we have an auricular acupuncture workshop where they go over all of the ear acupuncture points. The entire workshop is on how to treat the whole body through the ear. I know that we have a concussion workshop coming up in the near future. If you get online and just look up Dolphin MPS courses, you can find those, and they'll probably send you an email and let you know when those courses are coming up. Okay, so that's how to find acupuncture points, motor points, and trigger points. The next thing we need to talk about is how to treat a scar. This is actually one of my favorite parts of the workshop. It is one of my favorite courses to teach because you cannot do a better job releasing scars with any other tool that I know of. So I have spent my career working for neurologists and neurosurgeons and physiatrists and a fair amount of time, one day a week in women's health for about 15 years. And I have treated tons and tons and tons of both surgical scars, injury scars, and burn scars. I have done it manually. I have used gua sha scraping tools. I've tried ultrasound. I've sent my patients out for needling into scars. I have sent them out for injections into scars. There's all kind of different ways you can go about trying to treat a scar. And what I can tell you about treating scars is that all of them will, well, mostly, not really ultrasound, or a TENS unit, but all of them will work to some degree. It's just a matter of how much time you want to spend doing it. If you want to do it quickly, then you want to do it with microcurrent. That is absolutely the fastest way to do it. And the injections aren't bad, but there are some limitations to them. Number one, they're expensive. Number two, you got to have somebody who can do injections to do them. Number three, you have to stick that needle in every little part of the scar because the scar is only going to release where you inject fluid. It actually has to contact the actual scar tissue. So it's a lot of poking around with needles, which can be fairly uncomfortable. And you're limited because if you start dealing with deep abdominal adhesions, you can't go poking big, long needles down in here. But because we are using microcurrent and using electrons, you can do all kinds of cool releases with these. So let's go over why you would want to treat a scar and how you would go about treating scars. So why would you want to treat a scar? Well, the first obvious reason is it hurts. And it doesn't matter if the scar is a year old or 70 years old. I've treated them all. They all respond exceedingly well to this treatment. My expectation is if you come to me with a painful scar, the first time I treat you, I expect for that scar to be at least 50% less painful than it was when you came in. And probably more than that, but at least 50%. So what are some other reasons you want to treat scars? Well, scars can look bad. Scars can get all raised up and ugly. You may want to flatten them out some. Scars can be dipped in. You may want them to rise up a little bit to become even with the skin. All that is controlled with how tight the scar tissue is itself. You can actually reduce the raised ones quite a bit or bring up depressed scars. Scars will also affect range of motion. So if somebody has a knee replacement, what you'll find is they'll go through all the therapy, but sometimes near the end, there's still range of motion that they're lacking. And very often that's due to scar tissue. And if you use these, you can get range of motion increases very rapidly. Range of motion can also be affected from a distance. So to give you an example, I have seen cases where people had scars farther down in their body that affected things like their shoulders. So I'm going to demonstrate something for you. So if I had a scar down around my hip, so your body is covered with, you've got bone, then you have muscle, and between the muscle and the skin, you've got this body stocking called fascia. So it's connective tissue that wraps all around your body. It's one kind of big continuous set of sheets of connective tissue. So if I were to pull down on my shirt right here, I would have a hard time raising my arm up. My problem isn't my arm. My problem is what's going on down here. So I have certainly seen cases of people who had range of motion issues that were connected to scars from other things. And that's one of the things that gets missed a lot in therapy. So I've seen very old scars from childhood injuries affect very new injuries. So I've seen somebody have a shoulder injury and then not have any range of motion in it, and it doesn't respond to treatment until you go treat some of the older scars that are pulling on the fascia. So fascia can definitely restrict range of motion. Also, lymphatics. So if you have surgical scars on your body and you have any swelling in your limbs, there's a pretty good chance that the scar tissue is interfering with the flow of lymph back up through your limbs. So the only way to deal with that is to change the density of that scar tissue so that the fluid can move past it. Other reasons you might want to treat scars. From an acupuncture perspective, any scar that cuts through a meridian is considered to block the energy. And scars that are most damaging seem to be scars in this area because that is all your, remember how we said female energy is the most important energy because it's vital for life? Well, this is all of your ascending energy. So if you have C-section, hysterectomy, gallbladder, mastectomy, explant scars, implant scars, open heart surgery scars, any number of scars in this area, mommy makeover scars, even little holes like where they do in and suck your gallbladder out or something like that, those still count. And you can get deep adhesions in here. If you have one abdominal surgery, you have an 85% chance of getting abdominal adhesions. So that's scar tissue that grows beyond the boundaries of the surgical incision. If you have 2 abdominal surgeries, it's 100%. And I don't care if they did it laparoscopically or whatever, you're still going to have adhesions. So the scar tissue can wrap around your bowels. It can tighten things down. So it can pull you forward like this. So it affects your back. You wouldn't believe how many people I've treated over the years who have C-section, hysterectomy, and abdominal surgery scars that are big contributors to their low back pain, and they never knew it. And if you don't treat their low backs, then you're going to have their stomachs, you're going to have a hard time getting their low back to let go. Those same people with those abdominal surgical scars also tend to have a lot of upper back and neck pain. Again, if you don't treat this, it's not going to respond. And the last reason why you probably want to treat scars is that scars actually wind up your sympathetic nervous system. So if you'll remember earlier, we talked about this little yin and yang symbol and the fact that the white side of this is the yang side. That is your sympathetic nervous system. Well, scars electrically hyperstimulate the sympathetic nerve fibers. Not a lot, but a little bit 24 hours a day, 7 days a week. So over time, a scar could actually wind up your nervous system so your system can't relax. And you've got to electrically repolarize the scar. So now we're going to get into what actually happens when you treat a scar. So it doesn't matter if you're doing myofascial release. If you know anything about myofascial release, you will know that that is a piezoelectric effect. If you're doing injections into scars, you actually use procaine mixed with a couple other things. Procaine has an electrical charge that repolarizes the scar tissue. If you're using microcurrent, you're repolarizing the scar tissue. So normal body tissue has a resting charge that is negative, but scar tissue has a resting charge that is positive. So we need to repolarize that to normalize the tissue. Once you do that, we've done ultrasound studies, we've taken the pictures, we've compared them, we've had scientists look at it. Once you treat a scar properly with microcurrent, you're going to get about a 20% reduction in the overall density of the scar. So what that means is that that scar, although the scar tissue is still there, like you're never going to get rid of a scar unless you cut it out. People talk about breaking up scar tissue and whatever. Okay, it doesn't just evaporate and go somewhere. It stays right there. But if you change the scar electrically, it becomes less dense. So the less dense the scar is, the more pliable it becomes. The less tender it's going to be, the more fluid can circulate past it, the less it's going to stimulate the local sympathetic nerve fibers, the less it's going to interrupt the meridian flow, and the less it's going to pull on anything else. So we want to treat these scars to make them less dense. We get about 20% reduction in the density of the scar per treatment. So you figure about 5 treatments is good for most scars. Now, certainly there are times when you're going to spend a lot more time than that. I have treated a lot of burn scars in my career. Those steam, a lot of around here where I live, there are a lot of places that are paper mills. They use a lot of steam, and steam has a lot of energy and makes really deep burns. And those scars take a while to treat. But most surgical scars, 5 treatments or so and you're good. All right. So how do we go about treating a scar? Well, it's actually pretty simple. That's the thing I like about it. I just got done doing an entire 2-day workshop on treating scars. So what I'm teaching you tonight is just a very basic introduction to treating scars. But if you pay attention to what I'm teaching you tonight, you can do an awful lot for scars. Now, there's certainly a lot of cool tricks you can use, and different ways to add in acupuncture points to do it. But so this is a very basic scar release, but this will change the density of scar tissue. And once you change the density of the scar tissue, that's permanent. So whatever change you get in a scar, I can treat you today, and in 6 months, we can come back and remeasure that scar. And whatever change we got today will be the same in 6 months. And then you can keep going from there. So I could treat you once this week, once next week, once the week after that. I could do 5 weeks in a row and get most of the scar released. Or I could do one treatment a month over 5 months and probably get about the same outcome. So that's the nice thing about it. You don't really lose much ground when you're treating scars. So to demonstrate how to treat scars, the easiest thing for me to do is to do sort of a live scar treatment. So to do that, we're going to pretend like I have had an open heart surgery. So I'm actually going to take a piece of paper here, and I'm going to draw what amounts to a scar on here. So here's my open heart surgery scar. We're going to take one Dolphin Neurostim. We're going to set it on the negative setting. So on one side, we're going to use a negative polarity. On the other Dolphin Neurostim, we're going to slide this over to the biphasic setting. That's that plus minus symbol. So we're going to do a plus minus on one side. I'm going to get a little tape here so I can I'm going to tape this to my shirt so you guys can see it. There's only me here, so I don't have an assistant of some kind to hold this up. And if I try and use a pad, you guys aren't going to be able to see it very well. So this is probably the most efficient way for me to teach you how to do this. Okay. So let's pull this down a little bit like this. All right. So we're going to pretend like this is an open heart surgery scar. I have two Dolphin Neurostims, one in each hand. I have one on the negative setting. I have one on the biphasic setting. I'm going to turn them both on. I'm going to check to make sure I have a green light there. Now, this is different than looking for acupuncture points. When you're looking for acupuncture points, remember I said, go gently, look for the point, wait for the light to go off. There aren't any acupuncture points for the most part along here. As a matter of fact, scars hardly conduct electricity at all. So really what's happening is you're trying to restore the capacitance of this scar, its ability to conduct electricity back and forth through there. So to do that, we need to play ping pong with electrons. We need to bounce electrons back and forth through this scar. So I've got my two Dolphin Neurostims. I'm not going to try and look for acupuncture points. I'm going to turn them on. I'm going to put them on either side of the scar like this. I'm going to hold the black buttons down, and you'll notice I'm not on the scar itself. And I'm going to count out 10 beeps. Then I'm going to move down about 1/4 of an inch, count out 10 more beeps. Move down 1/4 of an inch, count out about 10 beeps. So what it's going to look like, from a practical standpoint, is you're going to be on either side of the scar like this, and you're just working your way down the scar, just a little bit off the border of the scar and about 1/4 of an inch at a time. So you've worked all the way down the scar. Now, once you get to the bottom of the scar, it makes a lot of sense to change the polarities. So you could either switch the polarities like this, or you could just change the units from one hand to the other. So you could just go like this. Then you're going to start at the bottom, and you're going to count out 10 beeps, count out 10 beeps, and you're going to count out 10 beeps all the way back up to the top. So that's 2 passes. Now, once you get to the top, I'm going to make one more pass. I'm going to change the units in my hands. You don't have to if you don't want to. That's just how I do it. And work all the way back down to the bottom again. So what I've done is I've made 3 passes, and I've counted out 10 beeps each time. So for a total of about 30 beeps on each little section, okay? Now, that's a bare minimum. So when I'm treating somebody in my practice for scar stuff, I certainly may go a lot longer than that, but I realize that some of you guys may be in physical therapy, occupational therapy practices, and in those situations, you have 15 minutes to do whatever you need to do, then you have to move on to other things. So this is a way you can get a scar treatment in that period of time and still get some pretty good outcomes. Okay. So we've done 3 passes, down, up, down, or you could go up, down, up. I don't care how you do it. It doesn't really matter. So what we're doing is we're just bouncing electrons back and forth through the scar. Now, you can't really do it with one of these. If you just have one of these, you're not going to be able to pass electrons back and forth through the scar. You need 2 separate sources of electricity. I have 2 batteries here. I'm able to push from each side, and I'm able to pull electrons forth back to across to the other unit, mix them up and throw them back. So I'm bouncing electrons back and forth through this scar. So what that does is that repolarizes all this tissue in here. Now, once I get done with that, I then go to the tops of the scars, and this may be a little bit different than what you see in your books, or you may have seen in our online workshops, but you're going to start at the top of the scar, and you're going to hold the units for about 10 beeps, and then you're going to work your way over the scar tissue itself. And you're going to do 3 passes this way at 10 beeps each. So again, we've done about 30 beeps on each of those points within there. And at that point, we're actually driving current straight down through the scar. So why didn't we treat directly on top of the scar to start? Well, the reason we don't start directly on the scar to start is scars don't conduct electricity very well at all. If you tried, you would have a hard time driving current through the scar. So we need to be able to bounce it back and forth across the scar first, and then we can push current down through the scar once it's a little more conductive. Now, some people want to try to do things like take pads like this and a TENS unit and put them on top of the scar and think that that's going to work. The problem with that is electricity always takes a path of least resistance. So the skin around a scar is going to be more conductive than the scar tissue itself. So what's going to happen is the electricity is just going to go around the scar. Like it's just not going to go through the scar at all, and it's not going to do a very good job of releasing the scar. Plus, this is high frequency alternating current if you use a TENS unit. So you want to stick to microcurrent when you're releasing scars, and it does it very, very quickly and very, very efficiently. This is actually one of my favorite treatments to do. It works just about every single time. It's quick. The patients notice a huge difference on the first treatment. The scars change visibly, and you can feel the change in the scar with your fingers. It is sometimes very, very, very dramatic. So that's sort of the basics of how we go about treating a scar. Well, what if we had a scar that wasn't like this? What if we had a scar that was more kind of more of a like a circular scar? Like what if we had, let's say, a something like a burn scar. So let's look at something like a burn scar for a minute. So we're going to draw a little circular scar here like this. And we're going to pretend like there's a burn scar instead of a nice, pretty surgical scar. What do you do with a scar like this? This could be a stab wound. This could be a burn. This could be somewhere where you've had the skin scraped off of an area. This could be where you've had skin taken off for a skin graft. There's any number of reasons. You had a cancer cut out. Okay, same thing as before. You want 2 Dolphin Neurostims. You want one on the negative setting and one on the biphasic setting. So we'll have negative on one side. We will have biphasic on the other. And you're just going to start on either side of the scar, and you're just going to work around it like this. So always keeping the units opposite to each other. So you're going to do 3 circles around the scar. So what we're doing, again, is we're bouncing current back and forth through the scar. Just bounce electrons back and forth. It's electron ping pong. That's what we're doing. Once you've done that, once you have it conducting a little bit, you're going to take your Dolphin Neurostims, put them on the scar, and you're going to work points through the scar tissue itself. It's going to take a lot more time because this is a lot more surface area than a linear scar, but well worth your time. So there's one other presentation I want to talk about. And that's what to do if you have someone who has deep abdominal adhesions. And this is a good thing to learn. So if you happen to have the vagus nerve stimulation kit for your unit, this is a trick you can use. We want the electrons to go in here and go deep. So what if we took a Dolphin Neurostim and we took one of these white cables that we actually use for vagus nerve stimulation, put a circular electrode on it and a rectangular electrode. So I do something like this. I'm going to put this on here like this. And then I'm going to take this electrode and I'm going to slap it on my patient's back like this. And I can do this with both Dolphin Neurostims. I'm just doing one just to show you. So now the electrons, when I set this down on my patient, electrons are going to get drawn straight down through the patient to the back. So I would have 2 Dolphin Neurostims with cables on them, 2 cables running to my patient's back, and now I can treat back and forth over any abdominal scar, and it's going to draw those electrons straight down through these deep abdominal adhesions. So you're going to get a much deeper release. I've had a lot of success with that technique. It's one of the things I teach in my scar workshop. So there's a little extra tip for you guys for the night. Definitely use that if you're doing deep scarring. You could put it on the opposite side of an arm where the arm was broken. There's a lot of ways you could use that. Okay. So other things we can do with the Dolphin Neurostim. The last thing I really want to go over tonight, and to be able to give you guys time to ask enough questions, is I want to know not just one pad. You can use 2 pads. So what I want to go over tonight is how to do vagus nerve stimulation. So we're going to talk for a minute about the vagus nerve, and I'm going to show you how to set it up. So what is the vagus nerve? The vagus nerve is the longest nerve in the body. It's known as a wandering nerve. It kind of starts on either side of your head right here. The easiest way to get to it in terms of nerve endings is around the ear. It runs down either side, sort of comes together in here and runs down into your gut. So it is known as the information superhighway between the brain and the gut. It is sometimes called your second brain because more messages are sent from your gut to your brain than are sent from your brain to your gut. So it is terribly important in regulating your autonomic nervous system. So if you are not recovering from injuries, if you have some kind of chronic inflammatory condition like an autoimmune disease of some kind, or you're recovering from something like COVID, or you have toxic mold exposure, anything that's chronic inflammation, or your nervous system is just shot, it's just wound down and you can't pick back up, this is what you want to do. It's also great for things like anxiety, modulating the nervous system. So when we do vagus nerve stimulation, it's a neuromodulator. That's actually what we're doing. We're changing how the vagus nerve responds. We're reprogramming it. So how do we go about doing that? And why would you want to do that? Well, let's say you were an elite athlete and you were measuring your heart rate variability every day. So you can look up HRV, heart rate variability. You might want to write that down. Google that up and look up heart rate variability. There are literally thousands of studies on it. There's Oura rings that people get will measure your heart rate variability. Sleep Number beds will measure your heart rate variability. It's not your heart rate. It's a time variance between beats, and it's a very good indicator of your overall health. The lower that number is, the less healthy you are. As a matter of fact, athletes track it. When their heart rate variability is high, that's when they train the hardest. When their heart rate variability drops too low, they actually cut their training down so they don't go into overtraining syndrome. So one of the things vagus nerve stimulation can do is bring you out of overtraining syndrome. When your body's run down and sick, it can bring your system back up so you can fight against things. Your autonomic nervous system, the sympathetic side of your nervous system, lets you fight against stressors. That could be anything from disease to somebody yelling at you to some kind of autoimmune disorder. Then your sympathetic or your parasympathetic nervous system helps you recover from things. So once you're sick, you need something to help you recover. That's the rest and digest side of your nervous system. That's the parasympathetic side. So you want to spend more time on the parasympathetic side than the sympathetic side, like we talked about before. So to do that, what are we going to do? Well, you have all the tools you need with your vagus nerve stimulator kit, if you happen to have it. So there are some things I'm going to point out. I don't know when you guys got your kits, so I'm going to point out a couple of things. The first thing you should have is a cable that looks like, let's see, where is it? It looks like this. It has a cup at one end and a male connector at the other end. And if you look inside there, you will see a nice little metal plate like that. Okay, you need one of these. You need a white cable like this. This is usually in the pack of electrodes you have. You will notice that it has what looks like a male connector on one end, a female connector on the other. But if you look again, you will see there's actually a male connector inside here. So this is just shrouded. These are both male connectors, so it doesn't matter which end you use. Some hospitals just require us to have the shroud on here, so that's why it's on there. Okay, you need those things. You are going to need some electrodes that look like this, rectangular electrodes that should be in your kit. And you're going to need some of these electrodes as well. These nice little oval electrodes. We have these specially cut. And if you'll notice, it looks exactly like this. So they're cut to fit this. You're also going to need some ear clips. Now, oh, and there's one other thing you need. You will, at some point, may need what's called a Y wire, which is one of these kind of things. So it's got two male connectors on one end, a female connector on the other. Depending on where you bought your units, you may have one that's actually a little shorter. So now we are making them that are much longer. So like this is sort of the difference between the two. Like you've got this little short one here and this long one here. I prefer the longer ones. So you can see that's quite a difference between them. So if you want the longer ones, you can call the company and order them. And you should also have a package of ear clips. Now, the ear clips are going to, there are going to be some black ones that have a little metal on them right here. Of the ear clips, these are the most conductive. However, these are really bad for trying to get into some of the areas of the ear. And if you have sensitive skin, we do not recommend these. Okay. Then there are some white ones that have a flat conductive rubber little piece on it right here. You do have to put a conductive medium on this to make it work. So you need to put some alcohol in here or on it, or some conductive gel of some kind, like EMG gel or something like that, like ultrasound gel, something that's conductive on there. And then there are also some ear clips, which are more recent. These just came out that look, we call them dome clips. You can see that this part is a lot bigger right here. And these are actually my favorite ones. So to show you the difference between these two, you see that this one is pretty flat right here. And this one actually has quite a bit of surface area on it. So these are my preferred ones. So why do I like these? I like these because when you're trying to stimulate the vagus nerve, there are three areas that we target. The easiest place to get to is the earlobe. But the earlobe has probably the least amount of innervation for the vagus nerve. Okay, so easy to get to, but the outcomes aren't quite as good. So the two other locations, based on MRI studies, if you wanted to look at concentrations of the vagus nerve endings, are on the inside of the tragus of the ear. So this flappy little thing right here inside your ear, that's this thing right here. Okay, that's your tragus. So inside there, like on the inside of that, is the highest area of nerve endings for the vagus nerve. However, it's not a particularly great place to put any kind of ear clips because they tend to just pull right off. So the second best place is what's called the upper concha of the ear. So this area right here is the concha, this area in here, and right in here is what's called the upper concha. And these are specifically designed to reach into the upper concha of the ear. So they go right up in here and you get good skin contact up in here. However, these will not work very well unless you put something conductive on them. I actually tend to use just a little bit of just like alcohol hand sanitizer because that's conductive to electricity. And then I just put this right in here and I'm good to go. So these are my preferred method of doing this. So I'm going to go over how to set all this up. So I have a Dolphin Neurostim. I have my cup here connected to the black wire. This metal plate in here needs to connect to the tip of the unit. So you need to push this firmly on here like this. Then you want to make sure this is really clean because these electrodes are expensive. So if you have to replace these are more expensive. The good news is these never go on anybody's skin. They're only going to go on here. So as long as you keep this clean, you can use those over and over. Each one of these I will probably use for months before I ever change it. So I'm going to make sure that I clean. I have a little alcohol here. I'm going to rub it on here really well. Grab a paper towel. Clean this off really well. Anytime oil gets on an electrode, it will impede its ability to stay stuck. And that's your enemy. All right. So now I'm going to take one of these oval electrodes. I'm going to stick it on this plate right here. I'm going to take my white cable. It doesn't matter which end of this I use. So I'm just going to go ahead and use the sharper end of it so that when I get close to my patient, the shotted end is there. So I'm going to connect this up. Now, the last thing I need is one of these electrodes. You're going to connect that onto the end of the white cable. So here's a basic setup for vagus nerve stimulation and one of my favorite setups. If you're using one electrode, you are going to generally stick to the left ear. So you're going to put this, and I'm just going to use the, I've got a black one on here, so I'm just going to use the earlobe to demonstrate. So I'm going to get a little bit of alcohol here. I'm going to put it on the metal plate here. I'm going to put this on my earlobe. Then I'm going to take this, and I'm going to put it over my left wrist, okay? So on the left wrist, there's a series of acupuncture points right here. There are 3 acupuncture points known as the golden triangle in acupuncture. And they look kind of like this, this, and this. So this is what they look like. This one's a little more, sorry, that one's a little bit towards the middle right there. So when I put this electrode on, it's in my best interest to cover those because these are calming electrodes. I mean, these are calming acupuncture points. These actually bring your sympathetic nervous system down so that I can put it on like this, or I can put it across like this if my wrist is small enough and stick it that way. Now, when I turn the Dolphin Neurostim on, the light should be off. The light should be off because it's conducting. So it's basically like I found an acupuncture point. So I have 2 choices at this point. I can either hold this button down. I'm going to set it on the negative setting, by the way. So you've got it on the negative setting because we want to bring things down. I can hold this button down for however long I want, or I can simply push this little black button right here. And then the Dolphin Neurostim is going to be in a silent mode. It's going to run from somewhere between 12 and 14 minutes. And once it's done, it'll let me know because it's going to go back to making some noise. And so at this point, I can just chill out, watch TV, do whatever I'm going to do, and the vagus nerve stimulation is running. Now, we do recommend starting with 5 minutes of treatment and adding 5 minutes a day up until you hit about 30 minutes a day. To give you an example of when you should use it, obviously you should check with your healthcare provider if you are consulting with somebody about this. So here's kind of my profile. I'm 53 years old. I raised 2 children by myself. I see patients from usually 8 o'clock in the morning until 6 o'clock at night. I run around a lot because my kids are 12 and 14 and they play sports. So I'm always running to games and picking up from practices. I have a very physical job because I do manual therapy. I run around teaching workshops and go to medical conferences probably once a month. So my life is good, but it's stressful. It's just I'm going all the time. So for me, what I find is if I do vagus nerve stimulation twice a week for about 30 minutes, that helps me out with my recovery. When I do that, what I find is that I'm not so exhausted at the end of the day. But if I don't do that for a few weeks, I start to lose steam and I eventually get more and more tired. I hit the point where I feel like I need to take naps in the middle of the day. I get home, like I don't clean the kitchen after I go to sleep. I just go right to bed because I'm just done. Okay. But if I do vagus nerve stimulation and stimulate my system to recover, give it that extra boost, then I find I tend to have plenty of energy and do much better. Now, if I were like an elite athlete training for something like a marathon, or I was an MMA fighter who was training really hard every day, I would do vagus nerve stimulation every day. I would do it immediately after my workout, and I would do it for at least 30 minutes. When I had COVID, And my oxygen saturation was hanging around about 92 or so. And then I woke up one morning because I didn't do my vagus nerve stimulation and I didn't take the herbs I was supposed to take. My oxygen saturation dropped to about 80. And I really didn't think I was going to have to go to the hospital. It was a really bad day. But I was able to use vagus nerve stimulation to bring my oxygen saturation back up to about 90. And the way I did that was I put the vagus nerve stimulation on and I left it on for hours. And after a couple of hours, my oxygen saturation started coming back up and I was able to breathe a lot better. And I didn't end up having to go to the hospital, which is really good because I raised 2 kids by myself and I didn't want them to see me leave my own home in an ambulance and for them to be left alone. So a really good tool for recovery. If you have any kind of chronic inflammatory conditions, it's a really good tool for that. I cannot say like how well this has worked for a lot of people. If you look at the videos we have online, we've had people who have terrible shaking from Parkinson's disease, and it seems to be largely under control sometimes after doing vagus nerve stimulation. It's a great tool for you to use for anxiety. There's a lot of you get into the research on heart rate variability, you can you can find it tied to a lot of different disorders. So if you can manipulate that, so what this does is this raises your heart rate variability, not your heart rate, but your heart rate variability, which is a number that lets us know how really it's a measure of longevity. If your heart rate variability tends to stay high, you tend to be pretty healthy and live a long time. If that number stays really low, you tend to be sick a lot and you tend to die sooner. So it's a nice tool to have at your disposal. That doesn't mean that you don't still need to do your gut work and get your gut straight and take your supplements and do the things you're supposed to do and stay away from crappy foods and crappy substances. But it is something that will help you on your journey. Is an incredibly useful tool to have. And I can tell you that when I had my stepdaughter, who is autistic, it was a very useful tool for her. Because one of the big things with autistic kids is they have a lot of fear. And it really did a good job of alleviating her fear before she went to school. On days we did vagus nerve stimulation, her school day was much, much better. I will say she did not like the sound of the Dolphin Neurostim, and I definitely needed to have it on the silent setting when I was treating her. All right, now there is also this Y-wire business. Okay, so this thing. So how do you use this? Well, you're going to take 2 of these little ear clips and put them on there. And you're going to put one on either ear. You could put them on your earlobes. Again, put alcohol on them. You could put them on your earlobes, or you could put them in the upper concha of the ear. Then you're going to put your Dolphin Neurostim on this biphasic setting, okay? So this is going to go on your biphasic setting. So now, because one side of your vagus nerve tends to push energy up, the other tends to push energy down, so we're going to do this. Now, that electrode that we had on our wrist, we're going to keep that on our left wrist, like this. And again, start with 5 minutes, add 5 minutes a day. If it makes you uncomfortable, obviously stop, and you might want to just do one ear. So if you're going to use one electrode, stick with the left ear, unless you get super duper tired from a treatment. In that case, you can switch this over to your right ear. You can put the unit on positive, and you can put this electrode down on your tummy below your belly button and run it for about 5 minutes. But I don't recommend using the positive polarity on your right ear for more than 5 minutes until you really assess what the effect is going to be. And definitely don't do it right before bed, because sometimes it does really wind you up a bit, and you don't want to stay up all night long. So that's all of the kind of do's and don'ts with vagus nerve stimulation. We could probably spend hours more talking about it, but that's basically how to set it up and how to let it run. There are some contraindications for this unit. And there's one more thing I need to go over. The Dolphin Neurostim does also come with these extension probes like this. You'll notice that they are bendable like that. You can put them on the Dolphin Neurostim. You can use them to reach points around your back and neck. You can tape this to a back scratcher to hit points. You can use it to treat points in the ear. So there are a lot of uses for these. We have therapists who use them to treat internal scars in people's mouths. Obviously, they buy these. They're about $25. The patients have to buy them and bring them to treatment and clean them. So the do's and don'ts of using the Dolphin Neurostim, I like what I call the rule of pencils. Don't stick this thing anywhere you wouldn't stick a pencil. Don't stick it in your eye. Don't jam it way down your middle of your ear. Don't shove it up your nose. Don't shove it down your throat. Keep it out of the places you wouldn't stick a pencil. Other than that, you're pretty good. So there are a few contraindications. Don't stick it directly on top of your head if you have a history of seizures. Anywhere else on the head seems to be fine. And there are actually acupuncture points that stop seizures. And I have actually used them to stop seizures before, so it does work. Just don't do it directly on top of your head if you have seizures. If you have a pacemaker or defibrillator, you really, really, really need to check with the doctor first before you do this. You will notice that in the black case with the Dolphin Neurostim, if you pull that little flap up on the inside, there's a little booklet in there. In that booklet, all the electrical parameters of this equipment are in there. You can Xerox that off and show that to your doctor and say, hey, can I do this? And you'll either say yes or no. So that'll be between you and your doctor. Otherwise, any kind of electrical stimulation is cautioned if there's a pacemaker or a defibrillator. Now, things that are okay. So baclofen pumps, those are fine. Insulin pumps, those are fine. Bladder stimulators, those are fine. Dorsal column spine stimulators, those are fine. Plates, screws, artificial joints, stitches, surgical glues, all those are fine. Like none of those are a problem whatsoever. So those are all good. If you're treating somebody who's pregnant, get the doctor's okay first. Only do it under doctor's orders. And I would avoid the first trimester because about 50% of all pregnancies end up in a miscarriage. Most are so early you never even know it. But if somebody has a miscarriage and you treated them on that day, guess who gets blamed? That would probably be you. However, I have never heard of a case of anybody actually having miscarriage from acupuncture treatments. That doesn't mean it might not happen, so stay away from it. If you are treating someone who's pregnant, like if your doctor says it's okay, there are points to avoid. Don't go on top of the head. That pushes energy down. Don't go on top of the shoulders. That pushes energy down. Don't treat large intestine 4. That's a great eliminator. We're not trying to eliminate a baby. Stay away from the insides of the ankles. There are acupuncture points here that are actually used to induce labor. As long as you stay away from those, you're probably good. Don't treat directly over the tummy. I've seen doctors prescribe very powerful TENS units for patients to put on their backs, and it's never been a problem. But they always tell them don't put the pads directly over your tummy because you don't want to run that current through the baby. Okay. For cancer, don't treat over active cancerous tumors unless the doctor says you should. If the person has had cancer but doesn't have it now, you're fine. Small children, that's fine. Just do it a little bit less. Like I use these on my babies. We've taught workshops for All Children's Hospital down in Tampa. They were certainly using these on children and even infants, so that seems to be fine. So that's pretty well all the contraindications. So at this point, what I'd like to do is run through some of the questions you guys have in the chat section here and give you guys an opportunity to ask a few questions. So let me run through these real quick. When doing the deep abdominal scar release therapy, are both dolphins on the negative setting since they are sending the electrons to the pads? So there are two ways of doing that. You can actually put just one pad on the back with one Dolphin Neurostim and have the other one without a pad running to the back. And you can have one on negative and one on biphasic. That seems to work quite well because that tends to mix the electricity around a little bit. If you are if you're using two wires, you can certainly use the negative polarity, or you could use the biphasic on both of them, or you could use one on negative, one on biphasic. All those would probably be fine. All right. Let's see what else we have here in our messages. Can you treat scars that are close to the eye? Absolutely. Not a problem. Let's see what else we got here. Need to remove piercings? Not unless it's in the way of using the unit. Not a problem there. I will say, like, be careful with piercings because if you go through acupuncture meridians or anything or points, you can have negative consequences, and definitely don't use base metals. Use gold. Forgive me if you cover this. I've been screen recording while I had to work. I know you can't treat the top of the head, but I was told, or obviously the eyes, but I assume it's okay to treat forehead scars or scars on the nose or between the eyes. Is there any specific Adjustments to make in treating the facial area. No adjustments to make. We treat scars on top of the head all the time. Not a problem. So yeah, anywhere on the face, we treat scars. I even do treatments around the eyes for people who have vision problems. So that's not really an issue. Just be very, very, very careful if you're treating around the eyes. Firm contact, okay? Really, really firm contact. Because if you hit a point and that person jumps, this is going to go straight in their eye. So, you know, if you could put glasses on them and still get to the points, that's even better. But make sure you have firm contact. So the person jumps, you are holding their head down. Do not do it with the patient sitting up. Lay their head down, put your hands on them so their head can't come up. I'm really firm on that. We don't want to make anybody blind because you poked them in the eye. Okay, what else do we have here? Is there any research on using the dolphin with nonverbal autistic individuals? Not that I know of, but it seems to work just fine. It's been used. We have a lot of occupational therapists and physical therapists who have used this on autistic kids. It seems to be a good modality for them. With amenorrhea in teens, would you use positive or negative, just spleen 6? Well, I wouldn't use just spleen 6. I would treat the entire back. You want to treat all these nerve roots that innervate this area. Okay, so you're going to treat the back. Then you are going to treat a series of acupuncture points, including spleen 6. Let's see, positive or negative? I would say probably positive, but negative wouldn't be a bad choice either, just as long as you stimulate the point. You're definitely going to treat points over this area. If you have amenorrhea in a teen, I would probably go see a good functional medicine provider and get a panel drawn to see what's going on. Chances are there's probably some hormonal thing. You may have mold exposure. There's a whole bunch of reasons why. But you definitely, and you're going to do a lot of vagus nerve stimulation because you need to get the sympathetic nervous system working the way it's supposed to. Same thing goes if you're trying to get pregnant. Using vagus nerve stimulation calms you down. As you guys all know, there are tons of people who can't have kids. Then they go adopt a kid. And then as soon as they adopt a kid and the stress is gone, they get pregnant and they have another kid. So getting the stress down is a big deal. Let's see what else we have here. Have right side pudendal neuralgia. Is there a specific protocol to follow? Yes, there are definitely some things to follow. I would look in your books, probably the protocols for what you're going to find is the protocols for bladder issues are going to have most of the acupuncture points you need. So if you look those up, or you can request them on the Facebook forum. And the question is, why are you having pudendal neuralgia? Is there a nerve entrapment somewhere? So there, you may need to do more in a specific area. Occasionally we have people who will use the extension probes here to treat inside the body. Obviously, you'd want to sterilize this. But if you have adhesions inside, you can sometimes use that. I would try to find a physical therapist who's familiar with this device who can help you out with it. When would you use more intensity? Well, if you're not feeling it, I would just turn it up a little bit. You know, especially with scars, the more electrons you bounce back and forth, the better. General treatments, probably about halfway up is good. Could you please explain once more how to connect the pads and the cables for vagus nerve stimulation? Absolutely. All right, Dolphin Neurostim. Actually, let's do it this way so you can see it. All right, I've got a Dolphin Neurostim here. I have a black cable with a cup on it that is connected, and I have plugged an ear clip into the end of it, and I have a white electrode right here that's connected to a white cable, and I have that connected to a white pad. So I'm going to put this on my left ear, either on the earlobe or the tragus or the upper concha of the ear. I'm going to put this either on my left wrist right here, or I'm going to put it about 4 fingers below my belly button. And then you're set for vagus nerve stimulation. Patient had a chest scar, but multiple myeloma. Would you avoid treating? Again, check with the patient's doctor. A very dear friend of mine, her husband has multiple myeloma, and I have treated him for a number of things because the doctor said it was okay. So, you know. Can you use nerve treatment if someone is having idiopathic heart electrical issues? Well, what I can tell you is this. When we've had these evaluated in the past, um, what some of the labs have told us is that low frequency direct current won't fibrillate the heart. So take that for what you will. We've had pacemaker companies look at these, and they actually are a little surprised how little electricity is in these. So I take that to be a good sign. But if you have any questions, I would ask the doctor first. I'm not a doctor, so I'm definitely going to tell you check with your doctor on most things. Does vagal stim apply to a pacemaker or pregnancy caution? Yes, I would check with the doctor first on both of those. Did you say the right ear always needs to ground to the tummy? Right ear seems to do best. I mean, this is anecdotal, but over thousands and thousands of patients, we found that people tend to have a better response if you can go right ear, right wrist, or right ear to the tummy, but don't go right ear, left wrist. That doesn't work very well. Can you use nerve treatment if someone is having idiopathic heart? No, we've already gone over that. An MRI done, can't find a reason why the pudendal neuralgia have gone through the mill of pelvic therapy. That's Alejandro. So where are you, Alejandro? Let us know, and maybe we can find somebody to help you. Let's see here. Can you treat scar tissue daily? And for how long can you do the treatment on a scar from a chemo port? Yes, you can do the treatment daily. And you could do it for an hour or two if you wanted to. I typically, when I treat patients just for scars, when people come to me for scar problems, the first treatment's about an hour. Usually it drops about 30 minutes after that. But you can certainly treat for as long as you want to. If you're doing it for cosmetic reasons, you might want to treat it more often. When I treat scars, I'm treating for function and I'm treating for pain. And so 5 treatments is usually enough for me. South Texas. Okay, so is South Texas, is that like near San Antonio? It's in San Antonio. We actually have a lot of therapists around in Texas, so we can get you hooked up with somebody. That's not a problem. Confused about how to set up both ears at the same time for vagus nerve stimulation. Regulation on the device. Okay, to set up both ears, you need the Y wire like this, okay? And you need this connector. So you're going to connect this to the Dolphin Neurostim. Then you're going to connect this wire to the Y wire like this. Now you're going to put a clip on either end of the Y wire. And these clips go to your ears. Doesn't matter which side. Yep. These clips go to your ears. Yep. You're good. Now you need the white wire. Okay. So you still need the white wire. So you're going to take a white electrode. You're going to put it on here like this. And then you're going to take this and put it on your left wrist. That seems to work best for using both sides. So go to the left wrist and you should be good. Yep. Okay, let's see what else we got here. Closer to Corpus Christi, 1 hour south of San Antonio. Well, lucky for you, one of our instructors actually lives in San Antonio. Her name is, who is it we've got out there? I'll think of it in just a minute. And if we get you in touch with her, she can probably guide you to somebody who might be able to help you. And she could certainly she runs a physical therapy clinic, and she could definitely get you hooked up with somebody. She could bring you and do a treatment on you and teach you how to treat yourself. Is it realistic for deep adhesion C-sections to become unstuck? Yes. With adding the adhesion release, do you use the rectangle pad on the low back or set up both devices with rectangle pads? I usually use one rectangle pad. But yeah, when I worked in women's health, so you're never going to get rid of that scar tissue, but you can change the density of it. So it will, I guess that's Jill's question. Yeah, you will see some huge changes with that. It's actually quite impressive. I think you will be pleasantly pleased with the outcomes you're going to get. All right, so that's kind of all the typed questions here. Does anybody have any verbal questions they would like to ask? If so, just unmute your microphones and ask away. What are we missing, guys? I know it's a lot of information. That's why we give you a link tomorrow so you can go back and watch this as many times as you want to. Any questions? Are we good? Oh, wait a minute. I got another one coming up here. Let's see. Can you purchase the books without taking the course? You can't purchase the course books without taking the course. There are some, occasionally there are some protocol books that come up for sale. I'm not sure what's for sale right now. I know what they're moving towards right now is they're moving towards having all of the protocols available. And this is not, it's not set up that way yet, but they're having all the protocols. They're working towards having all the protocols available. So if you want, say, a frozen shoulder protocol, you click on the website, you pay $1 or whatever, and you get the protocol downloaded instantly to your phone and you've got it there. What tends to happen with our protocol books is people tend to steal our protocols and reprint them and sell them. We've had a lot of cases of that. So fortunately, a lot of the books we used to sell aren't being sold anymore because we've had so many cases of piracy of our intellectual property. So unfortunately, that's where things have gotten. People take pictures of them, they post them on the internet, and it takes a long time to come up with these protocols. We don't just come up with these overnight. Like, it takes a long time to put this stuff together. And when people steal that stuff, it unfortunately affects you guys. But that's just the reality of it these days. Let's see what else we have here. Will books be available at the courses? Yes. Any experience with vestibular issues like dizziness? Absolutely. Gosh, there's a whole bunch of things you can do for that. Vagus neurostimulation is good for that. You need to figure out what it's coming from. I mean, is it coming from mold toxicity? Is it come from you had some bad vaccines? Is it because you have trigger points in your SCMs and your scalenes and your posterior cervicals? Is it because you have actual inner ear problems? Do you have some kind of weird referral into your eye? There's a whole bunch of, yes, you can treat it, but there's a whole bunch of reasons why you would have vestibular problems. Who's that? Julia? Yeah, Julia, unmute, please.
Okay, I have a question. I do a lot of like mindful movement and breath work with patients. I collaborate with physiotherapists. So I work as a PTA, but I do more like somatic yoga type stuff.
Right.
And everyone at the clinic's using this. So I got on board because I was very interested in the vagal stim. And I was wondering if I attach the vagal stim and still walk them through some breath work,
Sure.
even gentle movement. Does that affect anything or change the way?
Well, so the Vagal Stim, and this is not a knock. I mean, you have to know like what does what, like what do needles do, what does microcurrent do, what does breath work do, and when you measure this stuff out scientifically, there are variations in all of it. So the biggest changes you're likely ever going to see in changing sympathetic tone is with vagus nerve stimulation. So it acts as a neuromodulator. So it's going to have a stronger effect than the breath work. However, you want your patients to be able to do this at home by themselves, right? So if you attach the vagus nerve stimulation and walk them through that, it shows them how they should feel. Does that make sense?
Yeah.
Like, this so quickly drops them. They're like, okay, this is what I should feel like. So what would take 20 minutes to however long of breath work, like you get in just a couple of minutes. So if you're
Yeah.
doing this in conjunction with that, you're going to take them even deeper. So it's a nice adjunct therapy to have with that. Like I'm a massage therapist. So a lot of times I'm doing just basic manual therapy work on people. I actually have vagus nerve stimulation on them because Massage, even though people think it reduces stress, is actually stressful. Scientifically, manual therapy is stressful to your system. It
Mm-hmm.
actually is a stressor.
Yeah.
It may not seem like it is, but it actually is. So I use the vagus neurostimulation to offset what the manual therapy does, so it takes them deeper down. And when people are concentrating on doing the things you're telling them to do, that's also a stressor, if that makes sense.
Mm-hmm.
So if you're using the vagus nerve stimulation at the same time, it kind of helps offset that. So it's a nice adjunct to have.
Yeah, yeah. Okay, great. Awesome. Thank
Right.
you.
Sure. Removed brain tumor. Yeah, you can treat the skull if you've removed a brain tumor. We actually do quite a few skull treatments on people. All right. Any other questions before we get done for the evening? Julia, where are you?
I'm in Toronto, Mississauga. I work. Maybe are you familiar with body science therapy?
I'm not from there, but our main office is actually in Toronto. You know that, right?
Oh, I didn't know that, but I saw there was a
Yes. So
in-person. Oh,
our main office is in Toronto. Like the guy who makes these
didn't know.
is in Toronto, who writes all the protocols. Yeah, he's
Oh,
right there.
okay.
And we teach workshops up there. As a matter of fact, in
November, I
I think
think.
it's November, we have a workshop up there. But yeah,
Yeah.
like if you go there, like you're gonna meet like the guy. Okay. So the
Cool.
guy, I think it's the auricular course. I think Todd's going to be teaching the auricular course. But yeah, if you go up there, I'm probably going to be up there. Todd will be up there, and Bruce, who's the guy who owns the company, will be there as well. So if you want to pop in, like it's a really good experience.
Oh, nice. Yeah, because I was thinking of doing the intro course just to get. I
Oh yeah,
would you need to do that before you do any of the other courses?
not the auricular. No,
No.
it's good to. I would pick up if you could pick up when's the I don't even know when the intro course is, but if the auricular course is coming up, it's only given a couple of times a year in Toronto, so I would pick it up. You can treat the whole body through the ear, and the ear is very parasympathetic, and it
Yeah.
sounds to me like you're doing very parasympathetic things with people, so that would
Hmm.
probably be very helpful for you.
That's
Can
great. Thank you.
I just interject here because
Sure.
Julia, I'm in Toronto, and I actually went and picked my unit up 2 weeks ago. They're in Southwest Etobicoke. They're like practically at the Mississauga border, so they're very
That's who
close.
I am.
Yeah, yeah. I heard you say you're in Mississauga, so
That'll
yeah.
make your life a little bit easier.
Sweet.
Any contact and workshops in Vancouver? Unfortunately, we haven't done any workshops in Vancouver in a long time. We may have some people out there doing it. I'm not sure who. That would actually be a good question to ask on the Facebook forum. I would like to go back to Vancouver and do workshops. It's beautiful out there. So if you want to have a workshop in Vancouver, like please let me know. I'm happy to fly up there and do a workshop. We just need like, I don't know, 12 people in a space to do it. If I got to run a hotel to do it in, that's going to be more complicated. If you have a clinic we can do it in, like that's a really good thing. All right. So my children are waiting for me at home. Both of them have tests tomorrow. So I have a very busy evening ahead of me. So unfortunately, I don't get to go home and sit back and drink a cold beer because we are going to be studying both algebra and social studies tonight. Thank you very much. So I'm going to wish you guys a very nice evening. Look for an email tomorrow. Please do join our Facebook forum and please do come see us in person. You guys are going to love the in-person workshops. They're always a lot of fun. We have great therapists who show up at them. Would it be more advantageous to use the vagus nerve stimulation before or after manual therapy? I actually use it during manual therapy. Like you can do it while you're doing manual therapy. There's no reason to do it and then do manual therapy. But if you were going to choose, I would do it before you do the manual therapy. All right, guys, I'm going to wish you guys a lovely evening. Have a great evening.